Hi, I'm Keith Naunheim. I'm a former STS president and currently I'm the chair of the STS-PAC Board of Advisors. I was asked to give a talk today on the STS-PAC, its origins, what it does, how it works, and it's darn hard to make this a sexy and scintillating talk. I will do my best to keep you informed, but it can be a little dry. What's a political action committee? Well, it was first formed in 1943. The AFL-CIO was the first one to form a political action committee. Unions, corporations, associations back then wanted to have some influence in DC, but they were essentially banned by statute from participating in federal elections. What a PAC is, it's a committee that allows associations, corporations, or societies like the STS to bundle voluntary contributions into a bank account and allow them to be deployed for those people who are seeking election or current incumbents in office. They're there to help us gain their attention and allow us to present our arguments about what policies need to occur in DC and how they ought to be, what they ought to be looking at and how they ought to be voting. There are thousands of PACs across the country, but there's just one PAC, the STS-PAC, that represents cardiothoracic surgeons in America. Who can contribute to the PAC? Well, any STS member can, but you have to be a US citizen or a permanent resident, such as a green card holder. The PAC itself was formed in 1997. It was actually sort of a self-defense mechanism back then because in the early 90s, Medicare started making cuts to all of surgery, and one of the greatest cuts was to cardiothoracic surgeons. They wanted to cut reimbursement by about 40 to 50% over a period of a year or two, and essentially this was formed out of self-defense. We were able to get to Congress, make them realize how damaging that would be, not just to us, but to our patients and their access to healthcare, and we were able to reverse and slow those cuts back then. Since then, the STS-PAC has been our main mechanism for influencing policy in DC over the past 20 to 30 years. What the STS-PAC does is pool the contributions from our members, it's the old strength in numbers approach, and utilize that to advance the policies that we need to improve the care for our patients and make it less onerous for us to deliver that care. Who governs the PAC? Who's in charge? Well, there's an STS-PAC Board of Advisors, and it's appointed by the STS board itself. It includes 9 surgeon members. It's the president-elect of the STS, or the first vice president, as well as the chair of the Health Policy Council. There's also underneath him the chair of the Health Policy Workforce, and then 6 other members. They appoint a chair, that's me, a treasurer, a resident appointee, and 3 other members who are interested in the political policies that go on in DC with regard to the STS. It's this PAC board that sets the strategies, the priorities, and the budgets. We do that with the advice and consent of the executive director, Elaine Weiss, from the Chicago office, and from the DC office, Courtney Yo, the STS director of government relations. And together, we set the course for the STS-PAC and decide where we need to put our emphasis throughout the year. What do we do with the contributions? We form alliances. Essentially, we identify people in DC who are running for office or incumbents in office who we think will listen to our point of view and will help us push forward policy that we think, once again, is important to deliver cardiothoracic care to our patients. Many of them are running for federal office, especially we give a lot to doctors because we know they know what we're talking about and they'll listen to what we have to say. These contributions are used to win their elections. Once they're in, we will often continue to contribute to their re-election campaigns because we want to keep their ear. We want them to listen to us when the rubber meets the road, when it's really a tough go, and when issues come up that we need to address, we need to be able to have a foot in the door and have them listen to us. Contributions are also used to develop and establish relations between our staff in DC and the staff of the congressional people so that there's a free flow of information on all the issues that we think are important. And we've had some significant accomplishments over the years, and these vary from essentially altruistic to self-serving. If you look at the top left on your screen, we helped repeal the sustainable growth formula. We did not want to, year after year after year, go back with our hat in hand and say, please don't cut our reimbursement. That was not only bothersome, but took a fair amount of resources, and it was inappropriate. That was self-serving. We've also been altruistic. If you look over on the top right, lung cancer screening, there's not a heck of a lot we get out of that, but we knew it was the right thing to do. Other altruistic things, the three outlined in the lower three octagons you see there, we help raise the federal smoking age to 21. We help reauthorize PCORI, the Patient-Centered Outcomes Research Institute, because we know that sort of research is important. And lastly, we help reverse the ECMO payment reductions. Medicare had reversed and decreased significant and instituted significant reductions to ECMO payment. And when they did that, hospitals were dropping out of it. They could not sustain their programs. And especially in a growing pandemic, that would have been life-threatening to thousands of patients. We helped them see the error of their ways because they really honestly had screwed up somewhat. They misinterpreted some of the data they have, and they reversed those damages, allowing hospitals to maintain their ECMO programs. We've done a lot of the altruistic things. And we also, once again, as I say, act in self-defense when we know that something is going to, if anything that threatens us, threatens access to our patients and their access to cardiothoracic care. And honestly, it's just wrong to let that happen. So who can contribute? Well, once again, U.S. STS members who are permanent U.S. residents, green card holders, U.S. citizens. And if you have questions about it, you can call STS, the Washington office. You can see the number up there. Or you can contact sts.org/PAC. If you give, we would love you to give as much as you think you can. Contributions made during the 2020 calendar year will be recognized in 2021 and in a web page and at the meeting. But the reason to give isn't to be recognized. The reason to give, honestly, is because this is the way you can make a difference in Washington. Those folks in Washington can make uninformed decisions that will harm not just us, but our patients. Our job, part of our job as docs, is to prevent that from happening. And the STS-PAC is likely the best way we have of doing that. It's how we get our foot in the door. It's how we keep their attention. And if we want our patients to have access consistently to cardiothoracic care, this is a necessity. You can see the platinum, gold, bronze, silver levels. You can get a book or swag for one or the other. But once again, that's not the reason to give. The reason to give is because you want cardiothoracic care to be available to your patients now and in the future. So if you have any questions, you can visit the website, sts.org/PAC. Jess Thompson, who's our PAC treasurer, wrote an article in the Annals, Advancing the Legislative Priorities of Cardiothoracic Surgeons. Feel free to do that. You'll also be able to call me directly. I'm in the St. Louis University. I'm in the phone book. Call Jess Thompson. Call the STS Washington office if you have a question, or the Chicago office. Any one of us on the Board of Advisors is happy to talk to you. We try to keep on top of the political issues and would like to tell you if you have questions, let you know what we can do, what we can't do, and at least explain what we're trying to do for the betterment of our society. So don't hesitate to contact us if you have a question. Thanks for your attention. Have a great day.